A schools special. This time next week, some pupils in England will be back. We'll put your questions to the experts, to the Children's Commissioner, Anne Longfield, to Dr. Mike Tildersley, who advised the government on schools reopening. For your children's health issues, Dr. Sarah Jarvis has the answers. And teacher turned rapper MC Grammar's lessons in lockdown. Don't forget, you can still get in touch while the pandemic continues. All the details are on your screen now. All that to come, but first, let's recap on a busy day in this pandemic. The Prime Minister's top advisor, Dominic Cummings, admitted going back to work when his wife first had COVID symptoms and said he doesn't regret driving from London to Durham with his family.
I thought, and I think today, that the rules, including those regarding small children in extreme circumstances, allowed me to exercise my judgment about the situation I found myself in.
In the last hour, Boris Johnson has announced outdoor markets and car showrooms will reopen next Monday, with all other shops expected to do the same 2 weeks later. And the Education Secretary Gavin Williamson said earlier schools must go back because coronavirus could be with us for a year or more. So the start of another very busy week for the government and for the country. In just a week's time, some primary school pupils in England are expected to head back to school. We're talking 4, 5 and 6-year-olds and 10 and 11-year-olds. I put some of your concerns to the Children's Commissioner for England, Anne Longfield. Anne Longfield, thank you for joining me. As you can imagine, we have been inundated with questions about Dominic Cummings. What do you make of his explanation about leaving his home with his child when his wife had COVID symptoms and that drive to Barnard Castle?
Well, I haven't heard the statement in full or the questions in full, so I can't really comment on that. Clearly, it's a very complex situation and feelings are running very high. The Deputy Chief Medical Officer, Jenny Harry, spoke about it at length in the briefing on Saturday. And she was clear to point out that the public health advice, of course, if you have anyone in the family has symptoms, then stay at home. You would normally expect parents to be able to look after the children throughout that process. If there are extreme situations where maybe both parents didn't had the disease, or indeed if a single parent had a disease and it was an extreme situation, there would be a safeguarding exemption. And that clearly would have to be looked at in a very kind of detailed way for that individual. If there are extreme safeguarding situations, of course, the authorities would be involved and they would help make that assessment.
OK, let's turn our attention to schools now. Tony got in touch to say the test and trace system is due to start on the 1st of June. So why not let that get up and running first, then let the schools go back? What's your response, Anne?
Well, I've been keen to get schools back up and running as soon as it's safe. I mean, there are children who have been missing out on their routine, their friends, and for many, their education, especially those that aren't able to go online at home and don't have access to the internet. So I want to get children back in school, but I also understand the importance of the tracking and testing. I think in reality, some schools will go back on the 1st, and those are the schools who maybe have the bigger, larger buildings. They maybe feel more comfortable with that, and others will go back over the coming weeks from there. It is, of course, only a small additional group of children because schools in the main have stayed open for this whole period of time. So it's more children in school. Schools are working incredibly hard to work out how that can be done. And parents and children will need to be comfortable and confident in that. But it's one that I think will grow over time.
Well, on that, Helen wants to know, how can teachers possibly get younger pupils to keep apart?
Well, I think the short answer of that is probably they won't. And a lot of the nurseries that have been operating throughout the coronavirus emergency have let children actually mix with each other in smaller groups, but they've not had to social distance because that would be difficult. And also it'd probably be quite upsetting for those children too. So they've stayed open. They've operated in small groups. They've done a lot of deep cleaning. They've asked parents to stay outside the nursery, and they haven't had major outbreaks of the infection. So I think it's possible. It needs a lot of attention to detail. We've seen in other countries how it can be done. But I've been heartened by seeing from Denmark, for instance, when children have returned to school, maybe a bit uneasy for the first day or so, but actually they're back with their friends, they're laughing, they're getting on with that normal routine.
Okay, on that feeling of unease, James wrote to say, there are many people talking about mental health as a reason to get children back to school. What about the children who are petrified at that prospect?
Well, children have been anxious during this period. They're not the ones that have been at the most risk in terms of their physical health because of the virus, but they have been anxious. Their daily routine was swept away overnight. They've been isolated from their friends. They're often worried about their own extended family too. So this is a big change again going into school, and it has to be for every parent to decide when over this summer term that is the right term. I'm sure it will help to see other children going there, and possibly if they can go and look around the school and see what's going on. There will be some children where school isn't always a happy place. Perhaps they're bullied in school or have difficulties with the school, and maybe they found a relief in being at home too. So it will be something that parents will have to help their individual children find their own way into.
Okay, I just want to ask you a question about the disruption to education overall. Sarah says she's a retired teacher, asks simply, why not rerun the whole school year? Is that an option? Because we're seeing a lot of disruption to a lot of children's education right now.
Well, I think some people are advocating that there should be at least a consideration of rerunning a whole school year. But I think that is in itself quite controversial. Children will often be separated from their friends if they're all aren't doing that, and there's a disruption around that. Plus is difficulties of children that will be coming into school and whether schools can cope. I don't think we know yet how this is going to become the new normal, whether schools are going to be able to go back fully at any point or whether they're going to be doing part-time rotas in September. So I think it's a bit early for that, but that's certainly something that some people are saying needs to be considered.
Anne Longfield, thank you very much. Thank you. We can speak now to one of the people who advised the government on the reopening of schools. Dr. Mike Tildersley is on SAGE, the Scientific Advisory Group. Good evening to you, Mike. Our first question is from Jessica, who wants to know, how can the government be absolutely certain our children remain safe when returning to school? Mike, your own children are due to return to school on Monday.
Well, of course, I mean, the simple answer to that is we can't be absolutely certain, unfortunately. What we have to do when we're making these decisions is look at the evidence that is in front of us. And if we look at the evidence, then of all the cases that we've seen worldwide so far for coronavirus, less than 2% of those have been in children. And in the UK in particular, there's been around about 2,500 cases in children under the age of 18 who've been confirmed, out of round about 260,000 so far. So that's 1%. So those children with very serious symptoms have occurred in extremely small numbers. Now, of course, I mean, this is absolutely no scant consolation for those parents who've been affected. And my heart absolutely goes out to the families who have unfortunately lost children, which is obviously terrible. But the risk to the average child going back to school of having severe infection is extremely low. What we know less about, and what we're still trying to gather information about, is children's role in transmission. We have certain evidence that children have a lower transmission rate than adults, but what we are still somewhat uncertain about is how much lower. And that's why any advice that we have put forward has been that any opening of schools needs to be gradual. And what we need to do is we need to monitor as we gradually open schools to look at the effect that that would have on the reproduction number, and if necessary, take action if we start to see that number rising.
Okay, the Prime Minister has just said he regrets the confusion caused by the Dominic Cummings controversy. Will that confusion make it harder for some parents to send their children back to school? Will they trust each other that they are not breaking some of the rules now?
Well, I mean, my experience so far, just from going out on my daily exercise, is that the vast majority of people have been extremely responsible. and observed social distancing. And I think that has, I think, surprised so many of us scientists in the very early stages, how the country have really united in the way that they have observed this. We've all been in it together. This, unfortunate incident, I hope, does not change people's resolve. I think this is the real time that we need to say we're in a position, cases are starting to decline. This is really cautiously good news. They are starting to decline. The number of admissions into hospital is starting to decline. But this is the point when we really need to hammer home the message. These measures are starting to be relaxed, but with social distancing in place. So that's a really, really clear message we need to get out. We are starting to get some semblance of our normal lives back, but this social distancing advice will be with us for some time to come.
Message understood. Katie wants to know why really young children rather than teenagers are going back first.
So again, this is a really difficult question to answer. All I can say is from the evidence that we have looked at, that we have put together with the forecast that we've put with our models, there's no clear evidence from the data that any particular age group is more vulnerable than any other in terms of either being infected or causing cases to rise. And so what we have always said, we've put all of this information together, and then any decisions regarding age groups that need to be sent back first really have to be made on welfare reasons and educational reasons, because in terms of risk, we have not found any evidence to suggest that a particular year group in primary is more susceptible than another.
Mike, a quick question on masks. Should children or teachers or both, any of them, be wearing them when they return to school? What's the latest advice on PPE?
So again, the PPE advice, I realise, is very confused. I mean, the situation is for children returning to school, the clear thing that needs to be observed first and foremost is social distancing where possible. Now, I accept I have 2 young children, and I accept that is extremely difficult. Good hygiene practice is really important, continuing to wash hands. In terms of PPE for children...
Yes or no, if you will. Sorry, Mike, to rush you. Yes or no on masks for teachers?
I would say that the good hygiene practices and social distancing is the key measure, but I think there's a practical aspect that needs to be considered by the government in terms of reassurance for teachers.
Dr. Mike Tildersley, thank you very much for joining me this evening. Thank you. Time for a short break now. When we come back, Chris Choi with advice for uni students and school buses. Dr. Sarah Jarvis answers your medical back-to-school queries, and...
Let me tell you what an adjective is. It's a word that modifies a noun.
Do you know an adjective from an adverb? The teacher turned rapper on lessons in lockdown. Welcome back. We've had hundreds of questions asking how school could change when some pupils return on Monday. Here's a quick guide. Scientific evidence so far shows children are at low risk of becoming very ill from the virus, but they can still catch and spread it. So, to prevent this, what could the new school day look like? The day may start earlier for some, with staggered drop-off times, and children may be asked to avoid public transport. Parents may have to stay outside the school while pupils queue 2 metres apart to get to their classroom. Class sizes could be smaller and children should avoid mixing with others. Pupils are unlikely to be able to share their pencils and other materials, and there will be more cleaning. Schools will also expect parents to wash their children's uniforms every day if they wear them. Currently, there are no fines if parents choose to not send their children to school. Schools in other countries like Denmark, Germany and France have reopened, but Italy and Spain have stayed closed. Let's join Dr. Sarah Jarvis now. Good evening to you. Before we focus on schools, Sarah, a question from Emma on Western General Hospital closing to new patients today because of a surge in COVID cases. Emma asks, is it the right time to further ease the lockdown in England, especially, I guess, with this confusion around some of the rules at the moment?
Absolutely, it's a very good question. And overall, we have definitely seen a drop off in cases. However, what we are seeing is that while, for instance, cases in London are dropping significantly, they got there first. They were several weeks ahead of the curve. Some parts of the country, such as the northeast, and now it would seem Western-super-Mare, are struggling more. Now, it may be that Western-super-Mare is just catching up. It may be that people looked at the weather. It's probably a bit too soon for that huge surge of visitors that they had last weekend to be having an impact now on admissions. But I think we do need to bear in mind that now is not the time to lose our nerve. We heard in the first half of the programme about how it's absolutely crucial. We've done such an amazing job as a society. We can't afford to ignore the rules now. And frankly, we cannot afford to make up our own interpretations of them. They are there for everybody, no matter what we heard this weekend.
Dr. Jarvis, thank you. Let's focus on schools now. Let's hear first from Karen.
So I'm currently shielding due to being immunosuppressed, having had a kidney transplant 3 years ago. Am I safe when my children return to school?
Is she?
Well, that's a really difficult one, Karen, because, of course, at the moment, people who are immunosuppressed, whether they're shielding because they've had a transplant, whether it's because they've got myeloma or blood or myeloma cancer, whether they're having chemotherapy, whether they've got cystic fibrosis, etc., have been advised they need to shield for 12 weeks from March. So that's going to take us over a couple of weeks. And that, of course, is for their own protection. We do know, as we heard in the previous half, that children are much less likely to get severe illness. But unfortunately, what we don't know is how likely they are to pass it on. So I'm afraid, Karen, it may well be that you are at higher risk as a result of your children going back to school. And my personal feeling is that because you really are shielding, and a lot of people have been confused whether they should be or not, but if you're shielding, you've had a transplant, definitely should be shielding. I would suggest you don't send your children back now.
Thank you. Sophie wants to know, should black and ethnic minority children be heading to school before the findings are out about why BAME people are more likely to catch the disease?
Great question, and you're absolutely right. There is evidence that people of BAME origin are more likely to have severe symptoms. However, that does not appear to apply to children. And again, to put this into perspective, 1 of 9,500 people who died in the 2 weeks up to the 8th of May were under 15, and that was a baby, very tragically, who was under the age of 1. So no school-age children in that group, and that includes people of BAME origin. Overall, we've had fewer than 10 deaths among children of school age, and again, that includes children of BAME origin. So it does not appear that children, regardless of their ethnicity, are at significantly higher risk of dying.
Briefly, Sarah, yes or no, if your child has got asthma, should they be going back to school next week?
The vast majority of children with asthma are not at increased risk. Now, I spoke to 2 consultants today about precisely this, and consultant paediatricians, both of whom said unless your child has very severe asthma, where they're repeatedly in hospital, they're repeatedly needing to take steroid tablets, maybe they're on continuous steroids and several inhalers, possibly a biologic, they are at increased risk. But for other ones, there does not appear to be a hugely increased risk. Again, this idea 1 million children in the UK have asthma, and yet the numbers of children who've had severe disease have been very small.
Dr. Jarvis, thank you very much. Chris Choi is with me to talk education too. Let's start with Owain. He says, I'm 17 studying for my A-levels. I'm desperately wanting to go back to school, but my parents aren't keen. Whose decision is it?
Well, at 17, generally, legally, you're regarded as a child. You're entitled to an education, but of course your parents have their parental responsibilities. Bring in the school, chat to them. They could be the first point of mediation. You could reach agreement. They could help allay those parental fears. Otherwise, if you can't reach agreement, they could signpost you to independent family mediation.
OK, Anjali is worried about school buses. She says they'll become fuller and fuller.
It is a worry, isn't it? And generally, guidelines are against unnecessary bus travel, including school buses. If your children do have to use one, make sure they're well versed in the distancing where possible, the masks where appropriate, the washing of hands. But look for alternatives. More than half of children get to school cycling, walking, or with that well-known chauffeuring service, the taxi of mum and dad.
Look, it's not just schools. University students are also in limbo right now. Louise asks, can we expect a refund for this year because we haven't received a full year of teaching?
Yeah, well, with fees for many people above £9,000 a year, it's a good question. Not a good answer, I'm afraid, for Louisa, because most universities are not thinking in terms of refunds. They say they're providing tuition, albeit remotely. However, if there have been particular problems, perhaps you've been too ill to study, you've had caring responsibilities or IT problems, talk to the individual university.
OK, 10 seconds to answer Caitlin's question. She goes to university in Bangor. Is it OK for her to travel from England to Wales? She's paying for her accommodation till the end of June.
I'm afraid not. Long-distance travel is against the guidelines in Wales. And anyway, the university would be closed.
Chris, thank you very much. And Chris and Dr. Sarah Jarvis will answer many more of your questions online straight after this. Before that, if you've struggled with your children's English lessons over the past 9 weeks, we may have found the man to help. Here is MC Grammar.
Hello, my name is Jacob. I'm a primary school teacher and an educational consultant. I'm otherwise known as MC Grammar, that teacher that raps all about grammar. Let's go! Lockdown has been a challenge. The classroom is very vibrant and dynamic, so staying indoors is definitely different. But with every challenge comes opportunity.
Let me tell you what an adjective is. It's a word that modifies a noun. Adding details, so why don't we look closer now?
Currently, teachers are the only bridge now between school and home, and it's so important to stay connected. And that's why I started the online lessons. Today, we're going to focus on that word there, clauses. The toughest skill at the moment is looking after 2 children under the age of 4. I thought I had it sewn up as a primary school teacher, but I'm learning new lessons from my wife every day. Be enthusiastic, have lots of energy when it comes to the lessons, be organised. You know your child, so base things around their interests. And remember, education doesn't just take place at school.
Question, can I ask a question? Only if you add a question mark at the end of the question.
Thank you so much for having me. Remember, stay safe, keep reading and keep rapping.
No one wants to see that. Thanks, MC Grammar. Thanks for all your questions. See you online for more or back here next Monday. Bye-bye.
Stay with ITV.
Chris Choi and Dr. Sarah Jarvis. Thank you both for joining me for this. Dr. Jarvis, if I can start with you, let's get back to this issue of Dominic Cummings. Are you concerned that people will start to break the rules, bend the rules a little bit after he admitted he did drive his family to Barnard Castle when we were in severe lockdown, and he went back to the work the day his wife had COVID symptoms, that self-same day?
I am extremely worried. We're just about to open up test, track and trace. And if people do not do what they are supposed to, then the number is going to go up. We've seen from Weston-super-Mare how perilously closely balanced it is. We have done an amazing job as a population by following the rules. And the idea that your solution to saying, oh, my eyesight had been funny, so to check if I could drive safely, I drove my wife and child 60 miles. I'm sorry, this is not the way to behave if you have coronavirus symptoms. If you don't feel entirely well, don't drive. If you have coronavirus symptoms, please stay at home. We think it's possible that all those cases we're getting down in the southwest may be something to do with people taking them there from other parts of the country. Please be sensible.
How concerned are you at the press conference today? They said that the R rate is still between 0.7 and 1. It's not seeming to drop.
No, it's not seeming to drop, but of course we have had a reduction in the restrictions. So I have to say, if anything, I'm quite reassured that it hasn't gone up further. The moment it goes above 1, we get to the stage where the number of cases is going to start to rise. We're currently at the stage where relatively small numbers of people, about 1 in 400 people, will expect to be infected in any 1 week. That's perhaps fewer than 1, for instance, in a school, and that's good news. But the point is that if the R rate is at 2.5 or 3, which is what it was when it started, if we all behave as we used to, then in 1 month, 1 person could result in 400 people getting infected, and 100 people could result in 400 times 140,000 people getting infected. We cannot afford to go back there.
We can't. Miranda wants your latest advice on testing. Let's have a listen.
My 4-year-old is due to return to school on the 1st of June, but if she shows symptoms of coronavirus, she's not entitled to a test. What happens in these situations?
We know at the moment that testing's just for the over 5s, isn't it?
It is indeed, and that's because logistically it's really difficult. The test isn't painful, but it takes quite a long time. You have to keep it up the nose and in the throat for 10 seconds, and that's basically very, very difficult to do for under 5s. That's the reason, because it just isn't reliable, because you can't get a child to stay still while you're doing that, particularly in the throat. So I think the answer is going to have to be they would have to be sent home, and they would have to err on the side of caution. If these children do go back, hopefully they'll be in smaller groups who will have been kept separate from other groups, and therefore that group could be sent home without the entire school needing to close. But we really do need the systems up and running before we open up schools.
Peter's got a similar question. As virus testing is only available to over 5-year-olds, how will reception and Year 1 children going back to school be monitored if a child does display symptoms? Will the whole class bubble have to isolate? What do you think?
Well, of course, a lot of Year 1 children are going to, in fact, all Year 1 children are going to be over the age of 5, and a reasonable number, quite a lot of reception children, because we're at the end of the school year, are going to be over the age of 5, so they can be tested. There is, of course, this trial of this so-called LAMP test going on in Hampshire just last week. If that's successful, it means hopefully we might have results in minutes rather than waiting a couple of days. But if we can't be certain that one child has or has not got coronavirus, then yes, that entire bubble will need to be isolated. And I think we do need to be warned that because children have not been with each other for 2 or 2.5 months, unfortunately, a lot of non-coronavirus type viruses are going to start spreading, and we are going to have children with fevers for non-COVID reasons.
Oh yeah, of course, back to school bugs. Talking about the teachers now briefly rather than the children, because that is a concern. Jade wants to know, she says, I am a primary school teacher and have been working from home because I'm 15 weeks pregnant. Should I remain at home and reconsider going back in September?
So it's a very good question, not least because, of course, pregnant women have been added to the list of vulnerable people. The good news is for any pregnant woman, I know you're 15 weeks pregnant, but at an earlier stage of pregnancy, there's no evidence, if you do get coronavirus, of early pregnancy loss. There's no evidence of increased risk of miscarriage, and there is no evidence of teratogenicity. In other words, fetal abnormalities, the baby being born with abnormalities. Actually, pretty much all the risk we've seen does seem to be in the third trimester. That's the last 12, 13 weeks of pregnancy. So in fact, I'm afraid by the time you get to September, you may well be in a higher risk category. Your risk at this stage is fairly low, but we would certainly suggest that you take all the precautions you can of, for instance, hand washing and social distancing where possible. And it may be worth thinking about wearing a mask, although that won't protect you, that would protect the children you're with.
Susan is a teaching assistant. She says she's a type 1 diabetic. She's really worried about going back to work on June the 1st. What's your advice for her?
That is difficult, Susan, because you're quite right. We have seen that people with type 1 diabetes as well as type 2 diabetes are at higher risk. And in fact, the risk for people with type 1 diabetes, in the most recent study, we've got a very big study looking back at people who've been affected, does seem to be higher than it is for type 2. But, and this is a really, really big but, the risk of having type 1 versus type 2 is nothing like as big as the risk of being older. So people who are older, that's by far the highest risk. If you then add being a BAME origin into the mix, that also increases your risk. Being overweight or obese also increases your risk. And very importantly, having poor blood sugar control also increases your risk. If you are relatively young and you have good blood sugar control, and hopefully you've managed to keep your weight down, I know it's been a challenge if you've got type 1 diabetes anyway, but particularly during lockdown, then your risk will not be increased nearly as much. But again, very important to talk to the school about what precautions you can put in place.
Okay, let's bring you a question from one of our viewers, Wendy.
My 4-year-old grandson has an extremely rare undiagnosed blood condition. He requires a blood transfusion every 3 weeks. He also has an enlarged spleen. Should he be returning to school on the 1st of June?
Should he?
I think almost certainly not. We know that people, for instance, who've had their spleen removed, there's been some confusion about whether or not they should be in the shielding category, and that's just going through the Department of Health at the moment. They've promised clarification. But he's certainly, if he's got a blood condition, if you've got a rare blood condition called SCID, then you shouldn't be. Severe combined immunodeficiency, you should be shielding. And if you've got various other conditions like sickle cell disease rather than sickle cell trait, then you should be shielding. So I would suggest that he certainly shouldn't be returning to school until he has taken advice from his specialist.
Okay, I want to bring Chris in now, and a question for both of you, but I'll start with Chris. A long question, but I think the situation needs explaining. Liz writes, I'm a student in Cardiff, and I share a small flat with 2 other girls. One left for home at the start of the pandemic, and the other girl went to London to see her boyfriend. 2 weeks ago, during lockdown, the London one caught a train and came back to the flat where I have been in isolation since the start of lockdown. Yesterday, her boyfriend arrived from London to stay in the tiny flat. This has made me feel uncomfortable and worried. Chris, she wants to know, is this allowed? Can anything be done about this?
Well, it is. It's like something from a soap opera, isn't it? It puts her in a very difficult position. I'm sure this is replicated around the country as well, because of these very difficult situations people are in. Of course, in Wales, you're still not allowed to go and see anybody from a separate household, certainly not to stay overnight. So this shouldn't have happened. But the tricky bit, of course, is the conversation. You're going to have to address this with the flatmate and boyfriend, make sure that they realise that the rules haven't changed, because there's been a lot of disinformation flying around. And just remind them, I suppose, gently, that ultimately the police could be called to look into any such breach, and that could result in fines.
Sarah, what's your take on that situation, medically speaking?
Well, of course, you wouldn't expect me to disagree in any way with Chris, and today is no exception. I absolutely agree with everything he said. From a medical perspective, though, the size of the flat really doesn't make a lot of difference, quite frankly. It is important to keep all rooms ventilated whenever you can. That probably reduces the risk. But if you're all living together, then frankly, you are all almost certainly going to be at the same risk. Now, once your flatmate and her boyfriend have been there for 2 weeks, then that risk of them having come down from London is going to have gone away. But what worries me slightly is if they are the sort of people who are going to travel willy-nilly across the country between houses, are they going to be the sort of people who use sensible precautions when they're staying with you? And that, to me, is possibly more of a concern.
Okay, Chris, I've got a question for you from Christina. And again, I can put this to Sarah as well in terms of what she thinks, medically speaking. Christina asks, hi, I work in a school as a cook. I have been furloughed. I also work in a nursing home part-time. Do you think I will be able to do both jobs when we go back to work?
Wow, Christina, not just one important job, but potentially 2. I think the key here is making sure that both of those employers are happy with this plan. My concern would be more, I think, with the nursing home residents. We know how vulnerable they can be. As an example, some care homes and nursing homes have actually asked carers to stay overnight on the premises. They're so frightened of infection from the outside world. So if anything like this does go on, it's so important, perhaps more so than normally, that all the right social distancing and hygiene practices are really strictly enforced. But don't do this quietly. Don't do this behind anybody's back. Make sure that this is completely out in the open and speak to those employers.
Sarah, what's your take on this? First of all, as Chris was saying, the fact that one of her workplaces is a nursing home. And secondly, the fact that I guess there'll be lots of people with potentially 2 jobs who are potentially going to be working in 2 different workplaces. What are the risks from that point of view right now at this stage of lockdown?
So Chris is absolutely right. Where Christina is concerned, the risk is not so much for the children in the school, but as we heard in the programme earlier, that we don't know how much they transmit it. We think they probably transmit it less than adults, but that doesn't mean they don't transmit it at all. It partly depends whether she's having any contact with children in the school. If she's just working in the kitchen and isn't going out into the dining room, then the risk wouldn't be any bigger than working anywhere else. So if she was working in another kitchen in a different care home. But if she's having contact with the children, then yes, there is some risk to her. And my personal feeling is that all care homes are going to want to ensure that their staff are at the minimum possible risk, and working in another public-facing environment is probably not going to be something they'd be keen on.
Dr. Sarah Jarvis, thank you for joining me this evening and for all your advice, all your answers to all of the questions this evening. Thank you so much. See you next week. Chris, I'll end with you. This is a question from Rebecca, but a lot of people have very similar circumstances. We've been told by my 13-month-old son, childminder, that he can return from June the 1st next Monday, but we don't want to put him at risk by sending him. My partner and I are both working from home. Can we ask a grandparent who is under the age of 70 and not classed as vulnerable to come to our home to babysit during working hours?
Well, currently this is against the guidelines, people going into another household, no matter how well intentioned. However, it gives us a chance to look to what is possibly the next step here. In England, government is talking about this model of a household bubble, whereby interaction would be permitted between different households on a certain basis. Scotland has also said it's thinking along the same line. So there could be a breakthrough here, something that Rebecca and others in that situation will need to look out for.
Okay, Chris Choi, thank you very much. And that's all from us for this evening. We'll be back at 8:30 next Monday with Coronavirus Q&A online. Thank you for joining us. Bye-bye.